So I want to talk about shoulder pain because it's a very common thing that I see in my office. I have kind of a different way of looking at shoulder pain or dysfunction, and I just wanted to share some of the kind of concepts that we use when treating shoulder pain. So a quick example is someone that comes in with pain in the front of their shoulder, and they typically have increased pain with things like push-ups, bench press, military press, anything overhead, stuff like that. So kind of what I do differently than a lot of other chiropractors or therapists is focus on the non-painful dysfunction rather than the site of pain. So the site of pain in this situation is the front of the shoulder, but the underlying cause or the non-painful dysfunction is something we actually have to search for. So I usually use a functional movement screen or some sort of movement assessment to identify that. So in the push-up test, what I'm looking for is, can the person go from laying flat to up into a push-up position using their body as a unit or a system, meaning it doesn't go the upper body and then lower body or lower body, upper body. So when I see something like that, what that means is there's a disconnect, there's a lack of core stability, allowing them to come up as a unit. So this is not doing what it's supposed to do. It's deconditioned or it's weak, whatever you want to call it, but their upper body may be strong enough to get them up, but they don't have the core control to keep everything locked in to one unit. That's what we want to see. So if I do an assessment like that and I see, a positive push-up test, or, I see a lack of core or scapular stability, obviously that's going to dictate the treatment. So I'm not going to necessarily focus so much on the front of the shoulder. I'll be doing some treatment here just to kind of help with the healing of the tissue and decreasing some of the symptoms or pain, but I need to focus on the actual root cause or the non-painful dysfunction, which in this scenario is a lack of core stability or scapular control. So that's what the primary basis of treatment is going to be. They're going to be doing some certain exercises and stability drills to try and regain better motor control and stability of all those areas, so eventually they can get back to doing push-ups without pain.